when exercising, some people don't get symptoms during exercise, but they get symptoms afterwards or the next day. Why is this? And I know that a lot of you guys that are listening to this right now are probably going to say that same thing or have that same experience, right? You feel fine when you're exercising, but it's the next day or it's later on that day. Well, we don't really know why that might be, but technically that is not considered a fail if you look at most exertional tests. We look at people to have symptoms during the exercise. And actually, what's more consistent with a failure or a physiologic PCS, which is due to blood flow or autonomic dysregulation, is typically symptoms during exercise, not afterwards, not the next day or anything like that. This could be due to a variety of reasons such as deconditioning or other things, but it's technically not a fail unless you get symptoms during or right afterwards. But with my patients, what I will typically do is if I do the treadmill test on them, let's say on a Monday, and they're fine during the test and they're able to pass, and then the following day they email me and they say, hey, I woke up this morning and I'm having an increase in symptoms. Do you think it could be due to the treadmill test? Yeah, it's possible. It could just be that you're just having a bad day, because that happens from time to time as well. But what I will do is say, let's just to be safe, even though technically you are safe, you're able to exercise to full exertion with no increase in symptoms, that's fine. But what I'll do to just help make them feel comfortable in exercising, because a lot of times if a patient becomes symptomatic after exercise, they'll become fear avoidant. Well, I don't want to do that again because that increases my symptoms, and I don't want to do that because they feel that it's making them worse. Well, it's not making you worse. It might temporarily make you symptomatic, but the more you do it, the less that will happen, the better you will become, especially if it's something like deconditioning, right? The better shape you get into, the less of an effect it will start to have on your body. You can actually start to ramp up your workload. But just to prevent a fear-avoidant behavior in the patient from pulling back and becoming non-compliant, typically what I will do is I'll take a look at whatever their maximum heart rate achieved was. So let's say they got up to 180 beats per minute before they were like, okay, I'm done, I'm tapped out. No increase in symptoms, but they got to 180 beats per minute. I'll actually just treat that as a fail and take 80% of that and say, okay, well, let's not work you out at 180. Let's have you work out at 150 or whatever 80% of 180 is. And then I'll have them work out at that rate rather than push themselves beyond that. So I will treat it like a fail, even though technically it's not. And we're actually teaching this exact strategy. You guys heard last week when I talked about the patient course that we are putting out. We actually give this exact strategy for how you can start working within your own range to find out what works for you and what doesn't. So if you do have a spike in symptoms, don't worry too much about it. If it happens the next day, just lower your heart rate slightly for the next day. But the big thing comes down to tracking. So get a heart rate monitor and actually track your heart rate, and that way you'll be able to actually have some data around this to know what level to work at. Don't just go willy-nilly.